This segment is sponsored by Metropolitan Pediatrics.
We are at Metro Pediatrics with Dr. Sarah Murdick. Dr. Murdick, thanks so much for talking to us today.
Yeah, of course.
Today we're talking about concussions, and you are a pediatric sports medicine doctor, so this is something you deal with pretty frequently.
Yeah, actually I do. And it's interesting because it takes a lot less to get a concussion than people think. We all think of the head-to-head hits that happen in football, and actually, surprisingly, you don't need to have that direct contact. I see quite a few concussions that come from an indirect type of contact. So if you imagine an egg and you shake up an egg, okay, the inside of the egg can actually get damaged even though the shell itself is totally fine and never took a direct hit. So those are those indirect type of injuries that I see from other sports other than football or soccer, which is the direct contact sport, where people may fall or just take a little shoulder hit that actually shakes up the inside of their brain enough to cause damage.
And what are the symptoms of a concussion?
Right, so there are 4 different categories of symptoms, and we all think of the kind of typical physical symptoms, that headache, the nausea, maybe a little bit of dizziness, and then we have some of the trouble remembering and a little bit of that fogginess. But surprisingly, there are a few other areas that people may not typically recognize as concussive symptoms. Those include visual problems, so maybe sensitivity to lights, some trouble focusing. We can actually have mood issues, so more irritable, more depressed, and then some trouble sleeping actually. So there's quite a wide variety of symptoms that can be directly related to concussion.
What do you do if you think your kid has a concussion?
That's a great question. So first and foremost, we say when in doubt, sit it out, okay? So if you're at a game and you think maybe they're having symptoms, they need to come out and not return to any physical activity until they've been properly evaluated by a medical professional. Second, I would call your provider to talk about, the possibility of their injury. And then when you think about how do we treat it, okay? The idea of complete rest is actually not as great as we thought it once was. So the studies are showing, particularly in kids, that an active rehab approach. So figuring out what is the threshold for symptoms and kind of working just below that. So if that means being able to go to school for part-time or in 20-minute increments, that is better than sitting at home doing nothing for days and days on end.
Dr. Sarah Murdick from Metro Pediatrics, thank you so much.
Thank you.
For more information on Metropolitan Pediatrics, visit them on the web at metropediatrics.com.